Men, listen up. This video is for you. November is Men's Health Awareness Month, also known as Movember. So you might be wondering why so many men are walking around with their beards and moustaches grown out. Well, it's to raise awareness for men's health issues that frankly aren't talked about enough. So these include mental health and suicide, testicular, prostate and penile cancer. Did you know globally that men die on average 6 years before women, and it's largely due to preventable factors? Right, let's get straight into testicular cancer. October was Breast Cancer Awareness Month. It encourages and reminds both women and men, yes, men do also have breast tissue, to check their breasts to check for any changes in lumps and texture and size. Did you know that the same thing also applies for testicles? When did you last check yours? According to Cancer Research UK, testicular cancer is the most common cancer in men aged between 25 and 49. So what do you need to do? You need to start having a feel of your testicles so you know what feels right and what is normal for you. So when you do your monthly or bi-monthly checkups, whenever you're free and have the time, then you know if there has been any changes and if anything is different. Now, I'll link some resources below explaining how you need to check your testicles. And the main thing that we're looking for is lumps that are new, that have changed. But that's not the only sign of testicular cancer. If you feel that there is a change in size of one of the testicles compared to the other, one feels firmer compared to the other, there's sharp or dull, aching, dragging pain, then that is also something to be concerned about. So start checking your testicles, find out what's normal for you, and contact your GP if there are any changes. The same also applies for penile cancer. There are 2 men diagnosed every day with this condition. So it is important to examine, have a look, and note any changes. Before we move on to the biggest area of men's health, which I'm really passionate about, let's also talk and touch on prostate cancer. Let me hit you up with some statistics. Did you know that there are over 52,000 men diagnosed with prostate cancer every year? That works out to roughly 140 patients a day. So shockingly, that means that 1 in 6 men in their lifetime will have a diagnosis of prostate cancer. And this unfortunately leads to over 11,500 deaths a year. So let's talk about the risk factors. Age is definitely one. Most commonly, prostate cancer is noted in patients aged 75 to 79. Those with a family history of prostate cancer, those of Afro-Caribbean descent, and those patients who consume a diet high in saturated fat and red meat. Now, the difficulty with prostate cancer is that it doesn't have very specific symptoms. The prostate is a gland that wraps itself around the bottom of the bladder where the urethra exits. So any changes to the gland itself usually leads to urinary problems. So these are things like going to pee more often, having a slow or weak flow, difficulty in starting urination, and unexplained urinary infections. In addition to these urinary problems, you may also get issues with your erection. You may get blood in your urine or semen, new and unexplained back pain. If you have any of these symptoms, the best thing to do is to contact your GP, who will often call you in to fill out a questionnaire regarding your symptoms, examine you, send you for a blood test, and do a workup for you and refer as required. But your job is to know what is normal for you and note any changes and report it to your GP. Now, a topic that I'm very passionate about, and that is mental health. We can't ignore the fact that men are more reluctant to present themselves to healthcare professionals or even friends and family regarding their mental health. In comparison to women, men are half as likely to come forward with any issues. And in 2019, men accounted for only a third of the referrals to mental health services. And unfortunately, the statistics show us that men are 3 times more likely to commit suicide compared to women. And the highest risk are men aged between 40 and 49. Now, there are a range of factors that lead to men being reluctant to come forward with any mental health issues. And one of the main factors that come up time and time again in research is related to masculinity. Men want to appear as tough and self-resilient, and for that reason find it very difficult to admit that they are struggling with their mental health, which contributes to the statistic that men are more likely to be sleeping rough, be alcohol and drug dependent, and go missing. If you are watching and you are struggling with your mental health at the moment and you're finding it difficult to open up, then I hope this video prompts you to make that first step in talking to someone. And if you are worried about a loved one's mental health, then please don't be afraid to approach them. And if they are reluctant to talk to you, please forward on some of the links that I'm going to put in the description below so that they can move forward and seek help in their own time. There you go, guys. That is November, which is Men's Health Awareness Month. Please, please, please make sure that you examine your testicles and penis. And if you have any mental health concerns, reach out to your GP or follow some of the resources I'm going to put down in the description and take care of your physical and mental well-being. Thank you so much for watching, and don't forget to subscribe, leave a like and a comment, share this video with any men you think that might find it useful, and I'll see you in my next video. Bye.